Hey, I know I haven't made a video in a while, and I'm really not that good at making videos, but, I just thought I'd give you guys an update because a lot's been going on. I think this is like my 5.5 months on T. I'm just taking a guess here. I think I started in April, and this would be like, I guess 5.5 months. But, yeah, I'm getting 200 milligrams every 2 weeks, so the dose is the same. Um, I think my voice has dropped since then. I don't really know though. I don't notice. I am getting facial hair, like more. I had facial hair, but I'm getting it more, like darker, thicker hairs. They, I don't really care about facial hair. I tend to shave it off, but just for the purpose of the video, I let it grow out a little bit. I'm getting them on my sides here. Uh, yeah. And as you can see, I'm getting a lot of acne, like all over. And it's not just my face, it's like all over my body. Um, you don't really notice it though, like the only place you really notice it is on my face. But I get like little zits like on my arms. It's kind of weird. It's always in the same spot, like right here where you would get your shot. Not your T shot, but like a regular shot, like when they draw blood and stuff. Yeah. My T shot, I actually get that on my hip. I rotate it, like, if I get it done on the right side, then the next 2 weeks I'll get it done on the left side. And, like that. Yeah, so. Oh, yeah, I got my name legally changed, and I got my gender marker changed. My name is Jeremiah Victor Jacobs. A lot of people just know me as Jacob, or Jake, because, it was my last name, so it was easier to just be called that. But it's actually Jeremiah. Yeah, so, for those who don't know, I'm 29 years old. I just recently had a birthday in July. Um, Also, let's see. Oh yeah, I had top surgery. I'm about like 4 weeks post-op. Um, yeah. I can show you. But I don't really like showing off my chest, especially when it's. I don't know. I have hips. I don't want to show it, but let me see if I can do it without showing my hips. um, Hold on. Yeah. Anyway, yeah. So as you can see, I had the double incision, and I had it done in Florida with Dr. Garamoni. Um, yeah, I had a lot of obstacles to get to that point. It wasn't easy because I needed to get medical clearance, and my doctor wasn't willing to give me medical clearance. And I tried to get it from another doctor, but every doctor that I called, they didn't want to take me in because I had insurance, and I should have done it through my insurance. But my doctor, my primary, wouldn't do it, so I couldn't, because they won't cover medical clearance for a surgery that's done outside of their insurance. You know, I have Kaiser, so if you're getting the surgery outside Kaiser, they won't provide medical clearance. Yeah, so I had to call like 40 different physicians before I finally got somebody to give me medical clearance. Um, yeah, I'm saying a lot because I really don't know what to say. I don't like making videos, so yeah. The other thing is, oh yeah, my name and gender marker. My doctor was being a dick about that too. So he wouldn't sign off on letting me get my name changed or my gender marker changed. He wanted me to literally strip naked so that he can examine my body. He doesn't want to see any ambiguous genitalia, half and half or anything like that. If it wasn't complete, he wouldn't sign off on it, which is ridiculous. I'm not going to subject myself to that kind of humiliation just because he doesn't understand the laws, So I called Kaiser and I told them I want a different doctor. I don't want to see him anymore. He's, been very, very ignorant and unsupportive of my transition. I can't do anything through him. It's always been a hassle. Anytime I went to him, I couldn't even go through hormone therapy through him because he just wasn't helpful at all. So everything I do, I just try and do it through my therapist because she's also from Kaiser, and at least she understands what I'm going through. Whereas this doctor has no idea. He has probably never met a transgender person before in his life, and he's just ignorant about the whole thing. And I kind of think he's mixing in his personal beliefs with his job because he doesn't seem to want to deal with me any more than I want to deal with him. Yeah. So I called him up and I got a new doctor. So this guy, hopefully he's better. I mean, I saw him and he seems to be pretty nice, and he signed off on me getting my name and gender marker changed. I have to take off my clothes, have him examine my whole body, because that would have just been wrong. To me, that's just wrong. You don't do that. I mean, especially when I have the letter from my surgeon saying that I am legally male, that I should be able to have it changed, that it is legal. I had the letter from my surgeon stating all of this. There's no reason for him to ask me to do that. And also I had it legally changed through the courts. So, legally, I'm a male, and that's my name, whether he likes it or not. But I'm not gonna, strip for him. Let's see, any other updates? Well, I look a lot older. I used to get mistaken for like 14, 15 at the most. But I'm 29, so at least now people think I'm like 18, 19. This is, a big improvement, right? Maybe if I shave my hair off, though, they'll probably go back to saying I'm like 15 or something. I don't know. Yeah, we'll see. I'm not a big fan of facial hair anyway, so probably won't be keeping it. Now, as for my love life, I'm not really looking for a love life, so to speak. I like getting to know people, hanging out, that sort of thing. And if it turns into something more, then I'm all for it. If I feel that way about them. But I'm not like looking for it, It'll happen when it happens. If it's meant to happen, it'll happen. Not sure what else to talk about. Yeah. I like playing with my facial hair. I may not be a fan of it, but I do like playing with it. It's just fun. Yeah, so I got my social security changed, my driver's license changed. I should be getting that in the mail within 3 weeks. Hopefully it'll be sooner than that, though. The only thing I can't stand is that my hips aren't going away. Maybe it takes more time, but I don't know. But they're just not going away. And acne. that is killing me. I'm not really sure if it's from the tea or from my diet. I'm pretty sure it's a combination of both, though. I don't know if one is affecting it more than the other, but I noticed I'm only getting it recently now because I guess I haven't been eating right, and of course, having a lot of hormones in your body doesn't really help. I don't know when I'm gonna make another update. Cause I don't know, my changes are kind of just leveling out. I don't know. Maybe maybe in 2 months, 3 months, if you're lucky, 1 month. But that's if I have anything to talk about. Uh, my oh yeah, I don't plan on being on T for the rest of my life. Cause you know what? I don't want my face to change too much. I like my face the way it is. I don't care. I mean, if it's a little more masculine, cool. But I don't want it to change to the point where I don't recognize myself in the mirror. You know what I mean? My dysphoria is pretty much just my body. I just want a male body. Completely male. No female. No VJJ, whatever. No vagina. Just penis, testicles, and pecs. Not boobs, but pecs. You know what I'm saying? And no hips. No. Just a guy's body. My face, I am perfectly content with. I don't even care if it's a little bit feminine. It's not, I mean, like I said, I don't even care about facial hair. I'm only doing it to show that I can grow it. You know. And I can probably grow a full beard in a few months. I don't know. It depends on if I'll, let it grow. Because I tend to shave it off. I just don't care. Yeah, that's about it, though. I'm not the most masculine, macho guy, but at least not in appearance. But I do feel that my body is too feminine. Just the shape of it. It doesn't work. And I understand if I go off T, like they say, your body, the fat redistribution is only temporary. It'll go back to being more feminine looking. But you know what? I haven't noticed a change in it anyway. Taking the T doesn't seem to change my body shape. At least not noticeably. So it shouldn't matter. It's the same as if I wasn't taking it, So I'm not too worried about that. I guess all I could do is exercise, and the more fat you lose, the less fat in your hips, right? I mean, I don't know what else to do. And some men have hips. It's a fact. So I have to remember that and make me feel a little bit better. Yeah, so I guess that's it. Guess I'll see you guys in a month or 2 or 3 or whenever I feel like making another video. Peace.